Okay, hello everybody, and thank you for joining us today. My name is Jennifer Persaud, and today I'm very pleased to introduce you to Dr. Helen Keane. Hello, Dr. Keane.
Hi.
Hello. Dr. Keane is a consultant rheumatologist. She's also senior lecturer at UWA, and she's the head of department of rheumatology at Fiona Stanley Hospital. And today, Helen is joining me to answer a Q&A type session about the subject of gout. So welcome again, Dr. Keane, and thank you for giving your time so generously to help our consumers to understand gout better. I'm just wondering if you might start by giving us a brief overview of what gout is.
So most people would recognise gout as a form of arthritis. It's usually characterised by very sudden onset of severe pain and swelling in a joint, typically quite a distal joint such as the toe or the ankle or a finger. But it's actually a systemic disease, and by that we mean it affects the whole body, which is caused by high levels of uric acid in the blood. And it's those uric acid crystals that deposit in the joints and cause the inflammation, which ultimately lead to episodes of arthritis that we know as gout.
Okay, thank you. So what's the prevalence? How many people typically are affected in Australia with gout, and what kind of people group is it particularly target?
So that's a really good question, because it's quite difficult for us to make good, accurate diagnosis as to what percentage of the population are involved. But the most recent evidence and our recent very thorough review of all the Australian published evidence suggests that probably about 6% of Australians are affected with gout. And that's people who tell us that their doctor has told them they have gout. So the sort of people who get it, it's generally men. So women who haven't gone through the menopause yet rarely get gout. So it's generally men. It tends to occur more commonly as we get older, more commonly as we have more health problems, particularly kidney problems, more commonly as we take more medications that affect our metabolism and our kidney function. And it also is associated with some diseases such as the metabolic syndrome, which is a syndrome characterised by high blood pressure, high cholesterol, and also diabetes, and we also see it in people who are overweight.
Oh, okay. So if I was sitting at home as a consumer and wondering if I might have gout, what kind of signs and symptoms might I be looking for?
Well, I guess for most people who have gout, usually have no trouble most of the time. But then they have these attacks of acute or very sudden onset severe inflammation, where they go to bed feeling fine, maybe some tingling in a joint, and they wake up in the morning with really swollen, hot, red joint. The pain can be incredibly severe, so severe you can't even stand having a sheet on it. And then the pain tends to peak within 12 hours or 24 hours and then gradually settle over time. So often if you did nothing, the pain would go away over a week or so. And then that may happen again in 3 months or 6 months in a different joint, in the same joint. So if you're having episodes of sudden onset pain in a joint that you can't explain, then I think you should think about gout.
Okay, so if I'm considering that I might be presenting with gout, how would I go about having that diagnosed?
So ultimately, we like to take fluid out of the joint and demonstrate those uric acid crystals inside the joint. Sometimes it's hard to do that because if you see us between an attack, then your joint may not be very inflamed and there may be not very much fluid to take out of the joint. And sometimes joints are difficult to put a needle into anyway. Sometimes the big toe is quite difficult, or some people get it in unusual joints such as their spine. They're very difficult joints to put needles in. So if we can't get fluid out of the joint, then we like to take a history and examination and do some tests. And if we put all of those together, we can build a picture that looks very much like gout, and that can help us be fairly confident of the diagnosis. So as mentioned, we expect sudden onset of pain in a joint which occurs rapidly and resolves spontaneously. Sometimes we can see changes on X-ray or ultrasound or a special CAT scan called a dual energy CT scan. And we also can measure the level of uric acid in the blood. And all of those things give us clues as to whether this may be gout that you're experiencing. And putting the whole picture together can give us relative confidence as to whether you do have gout or not.
Thank you. The usual pathway would be to consult with a GP in the first instance. When might I need to see a rheumatologist if I have gout?
I think you should see a rheumatologist if your gout is difficult to manage, because in the vast majority of people this disease can be managed. It's important to consider managing it, because whilst you may feel fine between attacks of gout, we know that every attack of gout you have is causing damage to your joints, impacting your life and maybe your ability to work, but it may also be having detrimental effects on your body elsewhere. So it may be contributing to heart disease and risk of strokes and things. So it is important to get your gout under control, even if it's only causing you trouble every 2 or 3 months. So management of gout requires just instituting a program of medications, which most GPs can do, but sometimes it can be troublesome to get under control. And I think that's when you should see a rheumatologist, because, as mentioned, the vast majority of people, even people with difficult to control gout, we can eventually get under control if we are patient and follow treatment guidelines.
Okay, so what might treatment guidelines include? Would I be expecting to have to take medicines to get my gout under control?
Yep, so the treatment guidelines really look at the patient holistically. So rather than just giving you medications for your gout, it's important that we talk to you, that we provide some education as to what's causing gout, and look at other factors that may be contributing. Your weight, are you drinking enough? Are you smoking? Do you drink too much alcohol? Is your diabetes under control? So we look at all of those things. We can manage the gout, the acute inflammation with some anti-inflammatory medications, such as drugs like colchicine, which is commonly known as Colgout, or take anti-inflammatory medications. And sometimes people take corticosteroids, which is known as Panacort or Solone or Prednisolone. So they're good in the short term to help you manage the acute attack. But then that doesn't prevent you getting longer term attacks. So we need to start giving you some urate lowering therapy to get the uric acid level in the blood down. And once we've got the uric acid level down, then you have, then we know that you'll have less attacks in the future, and hopefully no attacks in the future. So the drugs we use commonly to try and do that, there's 2 main different types of drugs. One are drugs that stop you making uric acid, and those drugs are allopurinol, which is also known as Progout or Xyloprim, and then there's a drug called febuxostat, and they work in a fairly similar way. There's a different type of drug which makes you increase your uric acid excretion in the urine, and that drug's called probenecid. So we start these drugs and we slowly, at a pretty low level, and then we slowly increase them until we get your blood uric acid at the target level. So we'll start you on a drug, maybe watch you for a month. In a month's time, check your uric acid. If you haven't met target, then we would increase the urate lowering therapy, hold you there for a month, check the level again, and so on until we hit target. I think it's important to note that these drugs, rather bizarrely, when you start them, can sometimes make your gout feel worse. So it's important to be aware of that and in touch with your doctor with a plan to deal with what to do if you get an attack of gout when you first start these drugs. Because what we don't want to do is have you start the drugs, get an attack of gout, stop the drugs. Then a couple of months later, start the drugs, get an attack of gout, stop the drugs. So it's better to start the drugs, manage the attack, continue the drugs. And in doing that, as I said, with time and patience and following the guidelines, we can get you a target and hopefully free from gout attacks forever.
Thank you, Dr. Keane. Just one last question. If I'm having an acute attack of gout, is there anything that I can do? Can I flush it out with increased water? And for the longer term, what can I do to help myself from a self-management perspective?
I think once the uric acid crystals have triggered the immune system to cause inflammation, there's probably little you can do other than taking drugs and to suppress inflammation and waiting it out. I don't think drinking water will be harmful, but I'm not sure that it will make the attack of gout heal faster. We do actually know that ice packs do help, so that is one simple thing you can do. In terms of lifestyle changes to prevent getting gout, it's the main things you can do is stop smoking, try and keep your alcohol intake under control. I don't want people to think they've got gout because they drink too much. That's a common misconception and it's not true. But some people do notice that they get a flare of gout when they drink certain drinks, particularly wine. So controlling your diabetes, blood pressure, cholesterol, those sorts of things, and also ensuring you're drinking enough water. So those simple things can help prevent getting attacks. I think if you look at diet, so there's a lot of people talk about certain foods will bring on attack of gouts. For example, seafoods, or fruits that are high in sugars, so pears, apples, those sorts of things. The reality is that altering your diet makes a very little impact on the amount of uric acid in your blood. And because gout is associated with high blood pressure and high cholesterol and heart attacks and stroke, it's really important that people with gout eat a heart-healthy diet. And unfortunately, a heart-healthy diet tends to be things like lots of leafy green vegetables, low-fat, high-protein foods such as seafood. So things that can be bad for gout are good for the heart. So nowadays we tend to ask people with gout to focus on eating a heart-healthy diet and maintain their cardiovascular health. And from the point of view of the gout, let's just take a tablet and not worry too much about the impact of diet on gout.
Okay, thank you. That's really sound advice. Really appreciate you giving your time to us today and to help our consumers with gout. I think this is going to really help them to be well informed, to make good decisions and to connect with their doctors if they suspect or if they have gout. So thanks once again, Dr. Keane.
Thanks, Jennifer. It was a pleasure to be here.
Thank you. Bye-bye.